What's going on, everyone? Happy Tuesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, April 16th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and today we're actually going to talk about one virus that I don't think we have ever talked about on the channel, but you know what? It's becoming concerning, and it's something that we must give a mention. Want to stay informed with all the viruses? Subscribe to my channel down below. Like the content you see here on the channel? Give it a thumbs up. Want to share this with other people? By all means, go ahead. The more people we get informed, the better, because people need to know what's going on. They need to know the reality of all these different viruses around the world. So let's face it, it's not a peachy, rosy picture like you were painted out to believe it is. It's actually a really serious picture out there, and you need to be informed. Alrighty, starting off today, the avian flu, bird flu, it continues to be a problem, and the H5N1 has now been confirmed in a commercial hatchery in Roosevelt County, New Mexico. The new outbreak affects 61,500 birds, so that is relatively concerning. Moving on to this, going up to Michigan now. As Mpox cases climb across the nation, Michigan's numbers are rising too. So Michigan is also seeing a rise. And it says here, since February, there have been 16 probable or confirmed cases of Mpox in Michigan. So that is something that is rather interesting. We hope that number doesn't rise any higher. But hey, it's something that we are keeping an eye on. Now moving on to this. I'm not always going to be all negative, and sometimes if I find some good news, you don't always have to agree with it. But I'm just going to report on it because I gotta try and be positive somehow. And this, it's positive. Believe it if you want to. COVID-19. Not associated with an increased risk of asthma development in children, which is rather interesting because I'm pretty confident that we have seen past studies that say we could increase the risk of asthma. So it's starting to get a little conflicting. And again, sometimes some studies, in the end result, even though there may be just an ounce of positive news out of it, they really try and hone in on that, and they try and minimize the risk of what's going on. Let's face it, there are a lot of kids out there that do suffer from long COVID and do have breathing problems such as asthma. So, yes, it can happen, but this particular study is saying it can't. Want to read more about it? I did tweet it out, and yes, it's going to make it into my archives. Just to be fair, it's going into the archives. I think I might have already put it there. If not, I will. But yes, there's a new study now that says, hey, COVID-19 does not increase the risk of asthma. We'll have to see. I'm sure there'll be more studies out in the future that may say something totally different. All right, there is this now, and this is not good news. COVID-19 found to increase risk of hospitalization, death in MS study. People with multiple sclerosis, MS, in England had a 7 times greater risk of hospitalization and forbid increased risk of death from COVID-19. And I can tell you right now, I do know someone who has MS. They had COVID. They were hospitalized with COVID. Actually, both the husband and wife were, which is, yeah, it was relatively concerning. We won't get into their whole story. I don't think they would want me to share it, but let's just say they were both hospitalized for COVID, and the wife did have MS. So there you go. I mean, there's proof right there that it does cause an increased risk of hospitalization. Continuing on. Well, yes, more news. Measles now. Las Vegas, Cincinnati officials track measles exposure from infected visitors. Health officials in Las Vegas area and Cincinnati have issued warnings about potential measles exposures in public locations linked to sick visitors from out of state, part of an ongoing rise in measles activity in the United States. If you want to read all about this, I will be making sure that I have this tweeted out as well. Why are we stopping it short? Because, well, we have more measles news. A second case of measles has been detected in suburban Cook County. This is in Illinois. It's a suburban county of Chicago. And remember, just this past weekend, we talked about the first case in Cook County. I believe it was since 2009. It was a really long time ago. So, yes, measles, once again, there's a second case now in Cook County. Now we're going to move on to talk about something that I don't think we have ever mentioned here on the channel, and it's good that we do, and that is called dengue fever. And in this case, we're talking about Indonesia. It's been posted on my site several times by the moderator, Steve, which he posts fantastic stuff. If you've ever seen his post on my site, or if you haven't, I should say, make sure you read his post. He posts a lot of good information, and he's made several different threads and posts about this, and I think it's time that we give it some attention because, hey, it is an issue. Dengue fever in Indonesia, 170% increase in infections and deaths compared to 2023. Yeah, this is not good. Summary. Deaths from dengue fever in the country of Indonesia are up by 179% in 2024 compared to this time last year. 475 deaths versus 170, and infections, it's not good. Infections have also increased by a similar percentage. 62,001 infections so far in 2024 versus 22,551 by the same time last year. So again, dengue fever, it is becoming a problem, and we can actually go back here to virus outbreaks, and you can see here, he's posted on in Argentina, Brazil, several different places, Puerto Rico included. So yes, it is becoming a problem, and who knows? Will we need a dengue fever section on the website? I hope not, but if it keeps spreading, we may, because you know what happens if something starts, really getting out of control and there's a lot of different places. I end up making a section for it. We'll see. All right, moving on now. Let's take a look at the air qualities in the United States. That concludes the news portion of today's pandemic update. Everything now is just going to be data, including some wastewater sites that I do want to take a look at. And speaking of data, some bad air quality data in North Carolina and South Carolina today. Not only are there yellows, there's also oranges as well. And now take a look at Texas. Yeah, Texas back through Arkansas, southeast Oklahoma, bad air quality for you, moderate air quality, well, yellow, we'll call it, in portions of the lower Great Lakes, and California, your normal bad spots are once again a problem today. Speaking of air quality, we do want to take a look at the risk of thunderstorms, and there have already been severe weather today in the portions of just east of the plains, portions of Iowa, Illinois. If you live in those areas, please stay safe. Heed the warnings. If you get a tornado warning, seek the safest place in your home. All right, that's today's little weather spot. This is not good. 788, well, this is Sunday's number. 788 EMS incidents on Sunday in Philadelphia. We told you that yesterday. Why is that not good? Well, here's why it's not good. Monday's number. 844 EMS incidents. Yes, the numbers continue to go up. And let's see what's going on in the burbs right now. It's 6:26 in the evening. I know we're late with today's update. Better late than never. If you follow me on Twitter at COVID Data Report, you know we had noise interference outside. And I'm giving you a heads up now. Either tomorrow or Thursday, there could be more noise interference. We may end up doing a pandemic update out in the wild. It just may be what happens. Take a look at Montgomery County, Pennsylvania right now. Head injury, abdominal pains, general weakness, dizziness, head injury, abdominal pains, again, unconscious subject. There are some calls to be had, but not terribly a lot of calls. But take a look at Chester County. I'm going to refresh this because sometimes it doesn't automatically refresh. Okay, everything's the same. We do see heart problems a couple times, falls, back pain, hypertension is also listed as well. Drum roll, please. Let's see, did we get anything from Walgreens today? I constantly keep updating it. Okay, so this is a surprise that I was not expecting in our pandemic update today. We do have an update from Walgreens. I refreshed it earlier in the day. There was nothing. So they finally did update. We're just going to do a couple states because I do want to get some wastewater in for Florida that we did not get to over the weekend. All right, taking a look here nationally. The national positivity rate is 13%. The prior week was 13.5%. Difference of down 0.5%. And looking at testing here, wow. Yeah, so remember, we did not have a Walgreens update last week. Total test, 4,875. And a reminder, In case you don't know, it says it here on screen, but in case you don't know, we are referring to COVID. Yes, this is COVID positivity rates. 4,875 tests this week. Apparently last week had 5,867. The number continues to drop. I'll have to take a look here when I'm done with today's update, see if there's any notes saying maybe they're only going to do it every other week. I don't know. Oftentimes when the testing goes down, Walgreens says, we're not going to really update anymore. I don't know. I am seeing some red here. I do want to know what that's about. Let's take a look at New York State. What's going on with New York State? Wow. New York State's positivity rate is 26.9%. This week was 20.1%. Last week, up 6.8%. But take a look. We do have a big testing drop. 171 tests versus 244. So, yeah, it's because of testing. And what's going on with California? California? Okay, this is a bit more concerning. California current week positivity rate is 14.8%. The prior week was 11.7%. And that's a difference of up 3.1% and 183 tests versus 180. Remember, folks, I just refreshed this, so I'm seeing it for the first time. You're seeing it for the first time. And California, though be it's not a big rise, it's a legitimate rise. Let's take a look at another red area. What's going on here? Okay, this is another legitimate rise. Mississippi, 15.8% COVID positivity this week. Prior week was 5.9%, up 9.9%. This is a bigger rise. 19 tests versus 17. Testing goes up, positivity goes up. That's never a good thing. I do want to zoom in, though. And you can see they are in an up, down regimen. And let's take a look at somewhere else that's red. Oklahoma. What's going on here? Oh, boy. This is not good. This is actually far more concerning. Oklahoma, 19.4% this week. Prior week was 14.3%. Difference of up 5.1%. 62 tests versus 56 tests. And you're probably going, well, why is he saying this is far more concerning? That's not as high as an increase as the previous state data show. Well, you have to look at this in my perspective. Oklahoma is known to have one of the highest long COVID rates. So anytime we see a big increase in Oklahoma, it's not good because their long COVID rate is just terrible. Plus, they also don't have that up, down regimen on the chart. Yes, it did go down pretty good, but then it just went up, went back to that level that it was at, and went even higher. And plus, then they've done more testing than they did do last week. So there's many reasons here. This is just not good for Oklahoma. But let's be fair. Let's look at somewhere that's green. We'll take a look at my state, Pennsylvania. We'll do more states again tomorrow. And taking a look here at Pennsylvania. This is actually good. 7.5% positivity rate this week. 12.2% last week. Down 4.7% with 67 tests versus 82. Testing down. Positivity rate down. That's a legitimate drop. I'm seeing a lot more red here on the map. We will give this more attention on the next data-filled pandemic update, which will either be tomorrow or on Thursday. I'm hoping for tomorrow, though. Taking a look now at what is going on with wastewater. We want to go where we left off yesterday. We left off in Los Angeles, but today we want to go east. We want to go to the southeast, take a look at Florida, because remember we had problems with wastewater scan over the weekend, and we want to see what is going on in a few places in Florida. First off, Miami, Florida is in an ever so slight rise at this time. COVID is in the medium range for you. RSV at this time, it's low. It's not much of an issue. Influenza, they're saying it's high here. And, it did see somewhat of a rise. Then it dropped a little bit, but it did see somewhat of a rise. Influenza B is not. Norovirus, still high, but it is really starting to drop at this time. Coming down here to hepatitis A, there are some detections of that. Quite a few, actually. And, again, I don't know how legitimate this is, where it shows this many detections when we don't actually get a whole bunch of news stories on hepatitis. So, who knows what the deal is with that? Not just Florida, anywhere in the United States. Taking a look at Mpox, no detections of that at this time. Now we have to go up a little bit further north. I want to see what's going on in Orlando. Let's go over to this wastewater site right here, Southwest Orange County, and we'll see what's going on there. Slight rise in COVID, but not concerning. RSV, no issues. And Influenza A, Influenza B, not much of an issue at this time. Norovirus, big issue. No, it's not calculated. I would definitely say it is in the high range at this time because look at that. It is really starting to take off. Ooh, that is not good. Yeah, you're seeing a big rise for norovirus. No Mpox issues, and hepatitis A is, yep, it's being detected at this time. I wanted to show you more wastewater sites today, but because we had that surprise Walgreens update, that's pretty much filled the time for that. We do have to take a look at some other data at this time. Hospital admissions in the past week, 7,318. ICU beds occupied by COVID patients in the past week, and that only makes up, I think, just 1% of the hospitalizations is what that is trying to say. And moving on here, epidemic status. It is likely growing in Massachusetts and Connecticut. And then when we come down to for flu, that was COVID. Now this is flu. And flu, it is likely growing in New York, Ohio, and Virginia. And moving on to one last thing from the CDC, JN.1 makes up 83.7% of the cases, JN 1.13, 9.1, JN 1.18, 2.5%, JN 1.16, 2.4%, and I'm sure when it updates again next week, this variant soup will probably continue to grow. Hopefully it doesn't, but it's been growing as of lately. All right, moving over to New Jersey. 193 COVID hospitalizations, with 68 out of 70 hospitals reporting. My goal for New Jersey is, can you get below 150 hospitalizations before another surge starts? Better yet, could you do under 100? I don't know if that's going to happen, but it's looking pretty good here. On a ventilator, just 4 people now. In the ICU, still 29, and there have been 19 discharges. New York State, speaking of good news, and well, kind of a mixed picture, but it's not all terrible. 278 new cases, not including those at-home tests, these guys right here. But again, that is a low number, and there was just an ever so slight increase in hospitalization. I thought this might happen today where they go slightly back over 500. It's 508 hospitalizations, 52 people in the ICU. By the end of this week, it'll be well below 500. That's my guess. I don't think it's going to be a sustained rise. And the ICU number continues to drop as well. As you see here, there were 64 people in the ICU yesterday. Today it's 52. Hopefully we see this number drop back below 500 tomorrow. Fingers crossed. Alrighty, folks, that does it for today's pandemic update. I hope you learned something. I hope it kept you informed. If it did, give it a thumbs up. If you're new to the channel and you liked what you see here today, well, I'd be glad to have you come back. Subscribe down below. If you have anything to say, leave a comment down below. If you feel more people need to see these updates, you know what to do. Hit that share button. Share it on social media. Share it wherever. Tell a friend. Tell someone who is high risk that needs to see what's going on. By more people we get to see these videos, the more people I'm going to help keep safe. And you know what? Another goal of mine is to turn around the minds of people that are saying, oh, it's no big deal. It's not going to be a big problem for me. I hope to turn them around and see, no, all these viruses are a big deal. And at any moment, any of the other viruses we mentioned today could go pandemic status. We don't hope for that to happen, but it could happen. Alrighty, folks, that's it for today's update. I will see you all again next time, which will be tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Tuesday evening, and thanks for watching. Take care. Bye-bye.